I wanted to talk about something that is called hyperpigmentation. Hyperpigmentation means anywhere on your skin that appears darker than other areas. Now, there are 3 of the most common types of hyperpigmentation that I'm going to discuss with you guys. I'm going to talk about what we can do for hyperpigmentation, ingredients that really matter, and then I'm going to talk about in-office treatments. So let's get started. Hi everyone, welcome to the Perfect Dose podcast. I'm your host, Dr. Kristin Herzog, board certified nurse practitioner and injection specialist. It is almost fall, you guys. Isn't that crazy? Today, I went for a walk this morning with baby and hubby, and I was like, holy cow, it is officially the time to be in Arizona. It felt good. I felt a cool breeze. So that was really exciting. And with that comes time for some more aggressive treatments. Now, I always like to mention that it is laser season all year long, okay? We live in Arizona. It's sunny all of the time, so you can technically get lasers at any point. However, it is safer to get lasers in the fall and the winter because the UV outside isn't as strong and you're able to avoid activities that require being out in the sun more frequently. It's not like you're going to be laying out in the pool in October, November. So it is really the time to ramp up these lasers. With that, I wanted to talk about something that is called hyperpigmentation. Hyperpigmentation means anywhere on your skin that appears darker than other areas. Now, there are 3 of the most common types of hyperpigmentation that I'm going to discuss with you guys. I'm going to talk about what we can do for hyperpigmentation, ingredients that really matter, and then I'm going to talk about in-office treatments. So let's get started. What is hyperpigmentation? We know that it is dark spots over our skin, but why? What is happening underneath? The why is so important to explain to you guys. I talk to my patients about the why when it comes to fillers, when it comes to biostimulators, any treatments, you have to understand what's happening underneath. So then you can say, okay, I get it. That's why Dr. Herzog is recommending what she recommends. So why are we seeing hyperpigmentation on the skin? And the answer is because there is an overproduction of something called melanin. Melanin is responsible for the skin color that we have, for our eye color, for our hair color. The more melanin that we have, the darker these features may appear. Some people have an overproduction of melanin and then they start noticing areas of hyperpigmentation on the skin. So what are the causes of hyperpigmentation? Is it genetics? What happens? Well, there are a few causes of hyperpigmentation. Some of that is going to be the sun damage. And maybe you're like, well, I've been going out in the sun for years and years. I've never noticed this before. Well, what happens with sun damage is we don't always see it. So sometimes we've been in the sun for years and years and the damage is just starting to show on our skin. So that is one of the main causes of hyperpigmentation. Another cause is going to be certain medications. Certain medications can cause an overproduction of melanin in the skin. We also can have hyperpigmentation due to hormonal changes like pregnancy, for example. That's a really big one. And some people are going to be more prone to hyperpigmentation just laying out in the sun. Rather than seeing it over time, they may notice sunspots pretty immediately afterwards. So those are the main causes. Now, what are the 3 main types of hyperpigmentation? And the 3 main types that I'm going to talk to you guys about today are going to be just regular sunspots, which happens from damage outside from the sun. And then I'm going to talk about something called melasma. And finally, I'm going to talk about PIH, post-inflammatory hyperpigmentation, because this is something that a lot of people suffer with. So first things first, let's talk about hyperpigmentation from the sun. Now, what happens in the sun is we're exposed to this UV, we're laying out, we're, by the pool, we may be using sunscreen, we may not be using as much sunscreen as we need to. And even if we're using adequate amounts, sometimes we just can't help but get damage from the sun outside. That's just the name of the game when you're going to be laying out in the sun. That's why I'm always going to recommend to my patients to wear protective clothing, to always seek shade first, to reapply every 1 to 2 hours, and just try to be as sun safe as you can. If you're laying outside in the sun, you're a sun baby, and you start noticing these spots and freckles all over your skin, or maybe you were a sun baby and now suddenly 10 years later, you're applying your sunscreen every single day and you're like, well, what do I do now? That is one of the causes of hyperpigmentation, which is sunspots. And we're going to get into how to treat it, because really, whether you have hyperpigmentation from the sun or from the hormonal changes like melasma, or if you have hyperpigmentation from any acne scarring or post-inflammatory hyperpigmentation, we really want to target the same ingredients on our skin. Sometimes the office treatments are going to be a little bit different. So the next type of hyperpigmentation that I'm going to discuss with you guys is post-inflammatory hyperpigmentation, PIH. And PIH happens for people that typically have acne and they pick their skin and then they're like, oh my gosh, I have these dark spots on my face now. They haven't gone away. That is post-inflammatory hyperpigmentation. And some of you listening might be like, oh my gosh, that's me. I can't help it. When I see a zit in the mirror, I have to pick it. I'm guilty of this, you guys, too. I try so hard not to pick my skin. And this is why, because I don't want to be left with post-inflammatory hyperpigmentation. And then the final hyperpigmentation that I'm going to talk to you guys about today is going to be melasma. And melasma looks different than the other types. So when we think of hyperpigmentation from the sun, we're thinking sunspots, freckles, little brown spots on our skin. When we think hyperpigmentation because of PIH, that is going to be areas of darkness on our skin. And typically this is going to look like exactly where you had acne, maybe exactly where you had some sort of injury, you fell, you had a scab, you picked it, and now you have a dark spot, something like that. You will notice that's post-inflammatory hyperpigmentation. So there are very distinct areas that you have this. Now, melasma is different. Melasma is typically due to hormonal causes. Some people genetically are going to get melasma more frequently than others, and melasma looks different than the other types. Melasma is going to look like more of a symmetrical distribution of pigment on the skin. Typically, this is going to be on the forehead, on the cheeks. Most often, it is on the face. And this type of hyperpigmentation never goes away. And it is the hardest to treat. I always tell my patients, you can help get your melasma under control, but it will never go away. And even with hyperpigmentation, you may take off all your post-inflammatory hyperpigmentation with treatments. You may get rid of all the sun damage on your skin. The second you get back outside, it is going to come back. So it's something that you have to be treating constantly. You have to be aware that there are things that can make it better, but it may not go completely away. So now we know the three most common types of hyperpigmentation. We know what it is, which is that overproduction of melanin in the skin. Now I want to talk about what we can do. And there is a variety of treatments for hyperpigmentation that range from topical ingredients, and that means things that you put on top of your skin that you can buy at a medical office. You can get them over the counter. And then there's going to be in-office treatments. And you guys know I am a biohacker. I love supercharging treatments. So for hyperpigmentation, if you want the best possible outcomes, it's really important that we treat with in-office treatments in combination with at-home skincare. So ingredients that we need to put on our skin in addition to treatments in office. That's going to get you the best possible outcome. Now, some people may be like, well, I don't have access to these in-office treatments, so they're only using ingredients at home, and that's okay. And now some of you might be listening and you're like, well, I do all my in-office, but it's really hard for me to remember my skincare steps, and that's okay too. But just know that if you really want to biohack your hyperpigmentation, you need to do a combination of in-office treatments in addition to at home. So what are the ingredients that you need to look for? We need to be looking for pigment inhibitors. Pigment inhibitors are exactly what they sound like, something that stops or inhibits the production of pigment. So pigment inhibitors, the number one gold standard ingredient to help with hyperpigmentation, and that is all three types, melasma, sunspots, or PIH, is going to be hydroquinone. Hydroquinone is the gold standard. It is going to range in a variety of strengths. It is a prescription strength medication, so it's not something that you can go to Walgreens and buy. you need to be prescribed this by a nurse practitioner, a doctor, a physician's assistant, somebody that has prescription authority. And this medication works really, really well, but with something that works really well, it is going to have some side effects. So hydroquinone is typically going to be used every single day, twice a day for about maybe 3 to 6 months, depending on what provider you see. They will all have a different protocol for hyperpigmentation. So in my office, when I prescribe this medication, I love a 4%. That is the strength that I find to be most effective. And it doesn't have too many side effects. Still will have some, but not too many. And again, they can range from 2% and higher. I really love a 4%. And I tell my patients, apply this to the affected area twice daily. Now, with hyperpigmentation, you need to understand it won't go away overnight. So it's going to take time for this medication to work. I tell my patients, wait at least 4 to 6 weeks before expecting to see any change on your skin. And oftentimes you won't see really significant change for about 3 months. So you'll be on this medication anywhere from 3 to 6 months. You will be using it daily. And some of the side effects that you may experience are going to be increased irritation, dryness, almost similar to a retinoid. For everybody listening, if you've used a retinoid before, you know there is a reaction before result. So your skin might be a little bit drier. It could be flaky. It could be red. It could be irritated. Hydroquinone also requires us to practice sun-safe behavior because it is important to stay out of the sun when using hydroquinone, not completely out of the sun, but wearing a hat, wearing our sunscreen, because it can make our skin more susceptible to sunburns. So that's something that's a little bit difficult for some patients to withstand. That is gold standard. Pros, it works the best. It works fast. Cons, you have to get a prescription for it, and there are some side effects. You also can't be on hydroquinone forever. So that's something to keep in mind. It is something that I cycle my patients on, and then I switch them on to some other high potency pigment inhibitors that I'm going to talk to you guys about. And these high potency pigment inhibitors can be found over the counter. So you don't need a prescription for this, which is really great. So they're very readily accessible for everybody listening. Another thing to note is that hydroquinone is not pregnancy safe. So if you are pregnant, you cannot use hydroquinone. Everybody else listening, that is going to be the number one ingredient for your skin to help with hyperpigmentation. So what are some other options? Other options are high potency pigment inhibitors. And those high potency pigment inhibitors are vitamin C, niacinamide, and kojic acid. Vitamin C is my go-to, you guys. It is the most important ingredient that you can put on your skin. Whether you have hyperpigmentation or whether you don't, you need vitamin C. It is a powerful antioxidant that is going to help protect your skin from UV damage. It has antioxidant properties in it, so it's going to help with free radical damage on your skin. It helps even out your skin tone. It helps with hyperpigmentation. So this is an absolute must. I recommend this for anybody. If you're 20 and you're not using vitamin C, you need to run and grab this. If you're over the age of 20, I hope that you are using this on your skin. I recommend starting with use only in the morning if you're using other skincare products. If you're listening and you're like, well, I'm only using one product, that's all I'm going to do, then use your vitamin C morning and night. That way you get the most out of this ingredient. So number one is vitamin C. The next two, kojic acid and niacinamide, I don't actually recommend going out and buying a product with just these ingredients. I have found that there are a ton of skincare products out there that have these ingredients in them and have proven to be very, very effective. So my recommendation is if you're using a vitamin C already, go find another product that you love that you can use every day on your skin that fits into your skincare routine that has niacinamide or kojic acid in it or both. Now, some recommendations that I have for you guys when formulating a vitamin C, there are two different types of formulations that are the most popular. There's other ones, but these are the two most popular. It is going to be THD and L-ascorbic acid. So L-ascorbic acid is going to be unstable. It is also going to be less expensive, more readily available. It's the most common type of vitamin C that you'll find. But if you're somebody listening and you are sensitive to vitamin C, you have sensitive skin, I'm going to recommend a THD-based vitamin C. And that is the most stable form of vitamin C. It actually penetrates deep into the lipid layer of our skin. And it is great for sensitive skin. So if you are listening, I'm going to recommend the THD formula. Some of my favorites of L-ascorbic acid are going to be products like Skin Better. They have an Alto Defense that's really, really great. If you're looking at Sephora, you can find anything there that has L-ascorbic acid in it. You're going to want a 10 to 20% vitamin C. That's going to be the gold standard. For the THD vitamin C, I have Perfect Dose RX, which is my formula. I created it because I have sensitive skin and I wanted something that really made a difference, that wasn't crazy expensive, that everybody can use. It is also pregnancy safe. So literally anybody and everyone can use this product. I'm going to link it for you guys in the show notes. That is a THD based vitamin C. Products that I love with kojic acid and niacinamide in it are going to be a little bit more expensive. The one I recommend is Even and Correct by Skin Medica. I really love this product. It works really well. If you are on a budget, this may not be for you. Stick to just a vitamin C and the other ingredients that I'm going to talk about. But if you can work it in, this is more of an investment product. I absolutely love it. It's one of my favorite pigment inhibitors that you can add into your skincare routine. So these are the 3 high potency pigment inhibitors: vitamin C, kojic acid, niacinamide. But that is not all you need to take care of hyperpigmentation. There's other ingredients that are crucial in your skincare routine. And one of those is a retinoid. And you guys know I am an avid retinoid user. I am in my retinoid era. And what I mean by that is I am using retinoids every single day. Now, not everybody is a good candidate for retinoids, so I'm going to talk about some alternatives. And you don't need to be using a retinoid if you are 20 years old. I recommend waiting till you're over the age of 25 to start a retinoid in your skincare routine. Retinoids are amazing for cell turnover. That's what they do. They are going to remove dead skin cells, and then you're going to have fresh baby skin. So think of it as constantly turning over your skin cells, like a huge exfoliation. If you go to bed with a retinoid, you wake up in the morning, you are waking up with fresh new baby skin. This is very important for pigment. We have to promote cell turnover if we want to treat hyperpigmentation. We can't just stick with pigment inhibitors. We have to make sure that we are creating the space for pigment inhibitors to flourish. We need to have fresh new baby skin cells. So add a retinoid in your skincare routine. Now, retinoids are going to vary in strength. So if you are someone with sensitive skin, I am going to recommend a beginner retinoid. I actually have in my Perfect Dose RX formula an amazing product for beginner retinoid users. It has something called retinaldehyde in it, which is the strongest over-the-counter form of retinoid. So it's absolutely amazing. I love this for my beginners. And then for my super advanced retinoid users, if you're like, I don't care if my skin's irritated, I will push through it for the outcome, you need a prescription strength retinoid called tretinoin. That has to be prescribed. And with tretinoin comes some unwanted side effects. So just be prepared for some dryness, some flakiness, some redness on your skin. But once you get through that, you guys, it is absolutely amazing. Now, if you are super sensitive and you're like, I've tried retinoids, they don't work for me, or you're looking for a more natural alternative, maybe you're pregnant, you don't want to use anything unnatural, then you can add in an ingredient called bakuchiol. And this is an amazing plant-based retinoid alternative. It is one of my absolute favorite ingredients. It's a superstar ingredient. It's an antioxidant. It helps with collagen stimulation. It helps with pigment, literally everything. You can add this into your skincare routine in addition to retinoids, or you can use it alone. So if you're super sensitive, you're pregnant, you're like, I don't want a retinoid, grab a bakuchiol. If you are looking for something else to add to your retinoid to supercharge your retinoid, then I recommend getting a bakuchiol serum. And again, I'm going to link all of these products in the show notes for you guys so you can see my favorite ingredients. Another hot tip I'm going to recommend, if you are getting these products, you're like, okay, I have hyperpigmentation. I'm going to get my vitamin C serum, my pigment inhibitor, my retinoid, my bakuchiol. Make sure that you're putting this on your body. And if you're listening right now and you don't have hyperpigmentation, you just want to be educated, you need to be putting all of your skincare products all over your body. It is the ultimate hack, you guys. We are not just aging on our face. I put my retinoid serum on my elbows, my arms. I literally put it down to my boobs, my legs, my butt, my stomach, absolutely everything. It is a great hack for preventing stretch marks, for treating stretch marks, and also just for overall anti-aging. What I love about putting these products all over my body is that if you get a Perfect Dose RX formula, it's a serum. So it's very hydrating. It feels really good. For my Skin Better lovers, Skin Better just launched their newest body product, Alpha Ret, for the body. So that's an amazing product as well. I recommend using any of your skincare treatments on your body. Don't miss this, you guys. You will regret it later. Body is in. So run, grab a retinoid for your body, put it everywhere, including your face, your neck, your chest, your legs, your boobs. Literally everywhere you have skin, you need to slather this all over. So now that we've talked about topical ingredients that are going to treat hyperpigmentation, we need to talk about in-office treatments, because in-office treatments are how we are really going to get aggressive, amazing results with pigment. So in-office treatments are going to range from chemical peels to photofacials to CO2 lasers, and I'm going to talk about each one of those. I'm going to talk about my favorites, who's a candidate, who's not a candidate, and which one that you should consider. So first, let's talk about chemical peels. Chemical peels are absolutely amazing. They're super popular to get during laser season, which is right now. And what they do is they just take off that first layer of your skin. Now we have chemical peels that range from medium depth peels to aggressive, deeper peels to lighter, superficial peels. So pending your pigment issues, pending how much downtime you want, you can really decide which peel is going to be best for you. My number one go-to is going to be a VI peel. VI peels are a medium depth peel. They're absolutely amazing. They are very aggressive. So this type of peel is going to give you the snake skin shedding appearance. Typically, you're going to start to peel between days 3 and 5. You don't want to pick the peeling off your face. This is like the hardest thing ever. You want it to just come off by itself. You don't want to exfoliate this off. That's the hardest part about a peel, you guys, is the downtime, just getting ready to look crazy, like your skin is literally flaking off and shedding, but the result is absolutely amazing. When you get an aggressive peel like this, you'll typically do this peel in a series. So you'll get one peel, you'll come back 4 to 6 weeks later, you'll do another. Usually you'll get anywhere from 3 to 4 peels for full correction. And then maintenance is going to be one of these peels every quarter or whenever you can commit to the downtime, meaning staying away from the sun. This is very important because you don't want to get a burn. You don't want to be going into pools. So chemical peels aren't super ideal in the summertime. They're great around the fall time. So I absolutely recommend getting a VI peel if you want an aggressive peel that is going to give you the most impact. Now, if you're like me listening and you're like, Kristen, oh my gosh, I can't freaking do peels. I hate the shedding. I hate the downtime. I literally hate peels. I will take downtime any day, you guys, when it comes to Morpheus, lasers, filler. Let me be red. Let me be swollen. But I don't like my skin feeling flaky. I always want to pick it off. They literally drive me crazy. So I love a no downtime peel. And no downtime peels, one of my favorites, is a bio repeel. And it is literally a no downtime peel, meaning we put it on your skin. It is a TCA peel, so it's really great for getting into those layers of your skin, for helping remove pigment, for helping with pores, texture, everything. And you don't have any peeling, which is freaking amazing. I love this peel. It's super quick. You can add it on top of treatments. Now, because it is less aggressive and it is a no downtime peel, you're going to need them more frequently. So with the bio repeal, if you're coming in for a bio repeal because of pigment, you're going to need to do this peel once a week for about 6 weeks. And then you can get this peel as often as every single month. So it's something that you can just keep adding into your routine. I love a bio repeal. I don't have issues with hyperpigmentation. I just love it for my skin. So it's something I recommend to everyone, whether you have hyperpigmentation or not. It is an amazing no downtime peel. Now, the next line treatment, and I'm going from like minimal downtime, least aggressive to most aggressive, more downtime, is going to be an IPL or a photofacial. And these are absolutely amazing. What it does is it's a laser that literally targets the pigment in your skin. So you lay down on a treatment bed, a laser technician is going to use this photofacial device to go all over your skin. It's going to pull out the browns and the reds, which is absolutely amazing. amazing. So it's targeting just your pigment. It is not targeting other skin issues. So that's something to keep in mind. Typically, you will need a series of this pending how much your pigment is. So if you have a lot more pigment, you'll need more treatments, like anywhere from 3 to 6 treatments. If you have less pigment, then you may be okay doing a series of 3. I always recommend getting a consultation for this procedure, you guys, because not everybody is a candidate. That is the downside to photofacials, is they work absolutely amazing for pigment. It's a light, there's minimal downtime. The pigment literally gets darker, it flakes off, it goes away. It's fabulous. But it can cause some serious skin burns. So this is only safe for very light skin types. If you have darker skin, if you tan very easily, you are not going to be a candidate for an IPL. If you have melasma, you definitely are not a candidate for IPL because anything heat related can make your melasma worse. So everything we've talked about thus far with chemical peels, with ingredients, those are safe for all types of hyperpigmentation. It's safe for PIH, post-inflammatory. It's safe for sunspots, sun damage. It's safe for melasma, but IPL is not melasma safe and it is not safe for all skin types. So make sure you choose a very well-trained provider that can assess your face and tell you if you are a candidate for IPL or if we need to stick to other treatments. Now, the good news is there's another laser that I absolutely love, and it is a CO2 laser. And CO2 lasers are the gold standard for actually treating pigment, for fine lines, wrinkles, texture, literally everything on the skin. They're also melasma safe, which is super exciting. Settings just need to be adjusted. So all of these procedures, you guys, you need to go to somebody very well trained before considering getting this done. Don't Groupon, don't price shop, because with these aggressive treatments, it's going to take somebody very trained to assess your skin, to know if you're a candidate, to understand what settings to use these lasers on. That way we get amazing results. We don't damage your skin. So traditional CO2 lasers used to leave you with red, swollen, like you almost looked like a burn victim, you guys. If you Google CO2 laser, you will see some of the craziest photos come up. You'll be like, I never want that. That's insane. Tamra, for all my housewife fans, if you guys saw Tamra post on her Instagram stories, she got a CO2 laser in addition to her brow lift, and you can see her swelling. It was wild. Now, like I said, I'm okay with some downtime, but for me, I don't love that type of downtime. So what we have in our office and what I recommend for CO2 is going to be something called a cool peel. Cool peel is freaking amazing. It is a mild CO2 laser, but the head-to-head studies, you guys, we got amazing outcomes with a mild CO2 laser treating fine lines, wrinkles, pigment, everything without as much downtime, which is amazing. A CO2 laser is literally going to ablate the first layer of your skin. So it is ablative. What that means is it is taking off that first layer. So you need to be prepared for a little bit of downtime. Downtime ranges pending how aggressive we go. So if you're like, well, I don't want a lot of downtime, maybe you don't have a lot of pigment, or maybe you have melasma, we're going to treat you with lower settings. So you're going to look like you had a sunburn for around 3 to 5 days, and then your skin is going to glow. Another option is to treat you more aggressive. So if you have a lot of pigmentation, you have deeper lines, deeper wrinkles, deeper pore issues, we are going to treat you with more aggressive settings. So you're going to have a little bit more downtime. Typically with a more aggressive cool peel, we call this a DECA treatment. This is just the device that we use. So it may be different depending what provider that you go to, but at Perfect Dose, it's called a DECA. And this is a more aggressive treatment. With this, it is the same treatment time. So you get numbed, it doesn't hurt during the procedure, super easy, you leave red, but over the next 1 to 2 days, you will have a little bit more swelling. You're not going to look like the people you see on the internet with a traditional CO2, but you will look more red, more swollen, and you will also have more downtime. I tell my patients plan around 7 to 10 days of downtime. So 1 to 2 days of swelling. By day 3, you just have little like coffee ground appearance on your skin. And then by day 5, it's almost completely gone. By day 7, you will look almost completely back to normal. And then by day 10, you will be literally glowing. I'm going to show you guys my cool peel journey. So you can see I did a more aggressive treatment because I love aggressive treatments. So I'm always going to choose that option. And I will show you guys what I looked like day 1, day 3, day 5, day 7. I am absolutely obsessed with this treatment. And then I'm going to show you guys a photo video of what somebody looks like that didn't have an aggressive treatment, what they looked like day 1 and day 3. So you guys can really see exactly what that looks like. So to wrap up, hyperpigmentation can never go away. We can keep it at bay. I'm always going to recommend doing a combination of in-office treatments with ingredients on your skin at home, in addition to practicing sun-safe behaviors. If I had to choose out of all the lasers that I talked about, you guys, between IPL, between the cool peel, and between chemical peels, I would choose the cool peel. And the reason why is because it can treat more than just pigment. It treats fine lines, wrinkles, pore, texture. It's safe for all skin types, and it is very minimal downtime when it comes to how amazing the results are. So if you have to decide between those, I would choose the cool peel. Thanks for tuning in to this week's episode. I will see you guys next week. You can follow me on Instagram at The Perfect Dose.